Hello and welcome to Khan Klinics, our weekly health and lifestyle show powered by American Muslim Today. In each episode, we dwell in the realms of wellness, exploring the latest trends, seek expert advice, and practical tips to help you live a happy, healthier life. Our aim is to bring a broader perspective to our American audience and discuss issues that impact your daily life by interviewing guests and experts from the US and around the world. From nutrition and fitness to mental well-being and beyond, we're here to empower you with knowledge and inspiration. So whether you're looking to boost your energy, revamp your diet, or simply trying to find a balance in your daily life, you're at the right place. Join us as we embark on this journey towards a better, brighter you. I'm your host, Dr. Amir Khan, and together, let's unlock the secret to living life to the fullest. Today we have a very fantastic topic and a brilliant guest as well. We're going to be talking about chest pain and what's its implications and why is it important that we all identify it. Which chest pain is relevant, related to cardiac, and which is not. And that's very important. Our guest today is Dr. Maha Iftikhar. Dr. Maha is a graduate from ANMC. And she currently works at Pulmonx Plus and also works sometime at she works as a medical officer in the interventional radiology. So, Dr. Maha, how are you?
Alaikum, sir. Alhamdulillah, I'm fine.
Okay, so very good. Welcome aboard.
Thank you.
Before we start, we're going to play a couple of videos just to get ourselves introduced to the topic and stuff. So, Jeremy, why don't you go ahead and play our intro videos, please?
Yeah.
Let's do that.
Oh, I don't think I could do that.
You okay, Jeff?
No, I don't think I am.
No?
Oh.
Alright. Right, Jeff, I'm going to need you to get down on the floor for me, please.
Oh, it's hurting.
Alright, just lower yourself down.
Oh.
Right, Jeff, I'm going to get some help, okay? Right, Jeff, I've got you an aspirin. I'm going to need you to bring your knees up. It's going to help support you. I've got an aspirin.
I feel like I'm dying.
I need you to pop this one in your mouth for me, please. Open up your hand. Pop it in your mouth and give it a good chew and then put it under your tongue. Ambulance is on its way.
Oh, yeah, I feel like I'm dying.
Just deep breaths. That's it, well done.
If you suspect a heart attack, be sure to look for the 4 Ps. Pain in the chest, pale skin, a pulse that's weak and rapid, and perspiration. You need to act quickly. First, sit the casualty on the floor with their head and shoulders supported. Call 999 or 112 and ask for an ambulance. If you're in a care home environment, only administer aspirin if you're authorised to do so. Keep checking breathing, pulse and responsiveness. If the patient loses responsiveness, open the airway and prepare to give CPR if breathing stops.
So that's sort of like a little bit of an intro to our topic. And, a lot of you may not have seen people with chest pain collapsing like that or going through that sort of phenomena. But I think today's topic is all about identifying those patients and discussing a little bit about them. And then if you are there in that situation, what are the things you should look for? Who should you call and what you should do? So that's all relevant in our discussion today. We've got another video to play after this. So Jeremy, why don't you play a little bit of our second video and then we'll get Dr. Maha involved in the discussion.
Their chest in pain. But did you know chest pain is just one of many signs? Heart attack symptoms can vary from person to person, and knowing what they look or feel like could be life-saving. Some signs of heart attack are a little more obvious. But there are other subtler symptoms. Women often experience these seemingly quieter symptoms. Familiarizing yourself with all the symptoms of a heart attack is important, so you can spot them right away and seek help at the first warning sign. If you or someone you know might be having a heart attack, always call 911. Life-saving care often begins right inside the ambulance. Dispatch will also alert your nearest Munson Healthcare Hospital, where our award-winning heart team will be waiting. To learn more about Munson Healthcare's nationally recognized heart services, visit munsonhealthcare.org/heart.
That sort of sums up what we should be doing in some situations. But why don't we hand over the mic to Dr. Maha? And Maha, would you like to tell our audience a little bit about the chest pain phenomena and walk us through what is relevant and what are the things that we should look for?
Good afternoon, everyone. Today I'm here to present you about the chest pain and heart disease. But the main topic of discussion is which heart pain you can watch or which heart pain is an emergency. And I will also go over to the ischemic cardiac pain, non-ischemic chest pain, and their signs and symptoms. So what is chest pain? A general term of any dull, aching pain in the thorax. It can be related to cardiac issues and non-cardiac issues. If you see a person having tightness or poorly localized and it's associated with physical exertion or other stress, and it's relieved within a minute or with a rest, and it's usually, you can say that it may be a sign of cardiac disease or cardiac related issues like MI. Or if you see a person having sharp and stabbing pain and which is well localized and maybe positional and spontaneous at rest, it is usually related to the lung disease.
You're saying if we're feeling pressure or we're feeling tightness, that's a little bit more concerning. Pressure on the chest is something that we see a lot in clinical practice. They're feeling pressure all the time.
Yes.
And from that, we're going to say the intro video said the 4 P's that you need to identify. One is that, are they sweating? So if someone is saying, I've got pressure, I'm feeling it right in the middle, that's you're saying it may be poorly localized, but sometimes it is localized. It's right behind the chest. If they start additionally sweating with that, you gotta pay immediate attention. Even if you're across the room and you're seeing someone holding his breath, but you see that perspiration is another term, sweating is a term that we use here in the US. So those two things combined is sort of like a big red flag for you. So the take-home message, you see someone in discomfort, you're seeing chest pain, you're seeing that they're holding their hand at the chest, which is like Dr. Maha saying, and they're complaining. A lot of times they would do this. They're saying tightness because they're feeling the pain. Just remember, when it's cardiac, heart is just like this big size, right? It's not a big organ, and normally you don't even feel it pumping. So how severe do you think the chest pain is gonna be? So true MI can be so, and they sweat because the pain is intolerable. So the more the pain, more the heart demand gets worse, and it makes all of this worse. So that's why one of the few times when you go to the hospital, they give you which medication first? So they're gonna give morphine for you. One of the medication that has the severest of effects on you. Yes, they give opioids, as someone has said. Opioid, which opioid they give? Well, it's not a light opioid. It's gonna be something very severe, so your pain can dissipate immediately, because the more you're in pain, even a heart-related symptom or a heart attack. That's why this pressure, tightness, and it can be or something similar medication. And like I said, I think the purpose is you can't be in pain. Now, angina is a little bit different. That's not a full heart attack. So there's two terms that we're going to use. One is Dr. Maha was already saying infarction. MI is an infarction. Infarction is death of a cell. Ischemia, it is when the blood flow is low. It's not dead yet. Okay, when the oxygen is low, that's the issue with it. The oxygen is low. That's ischemia. So not death. So there's a distinction. All right. It can be focal. It has a trigger point. A lot of times, if it's not substernal, if it's on the right side, let's say it's on the right side, then you touch it. So I'll go and touch it. If she does a jump, then I know that that's not heart pain. Now, I don't want you to become doctors, but it's one of the signs that we will go and touch that chest pain. So if someone in front of you is having chest pain and sometimes they start becoming so anxious that they can't breathe. And when they know they can't breathe, they start sweating as well. But if you go and she say, oh, it's right here, right here. And if you go and touch and she jumps and you got to say, dude, this is probably not heart pain. You'll become very anxious. And that happens too. So the pain feature is a little bit different. It's like a sharp pain. It's focal, meaning it's got a touch point. And it may be when you move, it gets worse when you move. It's a tender spot. So this is very important for all of us to know. Okay, let's go on to check now the next thing, what Dr. Maha is going to present to us, because that was a nice curveball.
So, okay, there are many causes like issues in your heart, lungs, and digestive system. Some causes are life-threatening and some aren't.
Very nice. So let's go back. So you're saying the chest, the pain, intense pain in the chest could be ACS, which is called acute coronary syndrome, which means a heart attack or an angina, right? Heart attack. But there are other causes of you having chest pain, and it can involve the heart, and it may not be a heart attack, but of all the causes she's 4, 5, 6, 7 put down, the one that we need to worry about, and the one can kill you immediately, is the coronary syndrome, acute coronary syndrome, i.e. the angina, esophageospasm, or sometimes, and the other pains that can happen, like the heart attack. Okay, Dr. Maha, brilliant. Let's go to the next cause.
So the next is the type of the chest pain. As Dr. Khan already told you that when a patient feels pressure or tightness or heaviness on the chest or burning sensation in the chest, it's related to angina, unstable angina, and acute MI. So if there is tearing occur in the inner layer of your body main arteries, then it will be related to aortic dissections. Usually the patient with aortic dissection feels sudden severe pain, loss of consciousness, shortness of breath, sometimes shock-like syndromes like vision problems, difficult in speaking, and paralysis. When the patient feels chest pain, particularly pain in the lower chest, and it's triggered by meals, and there is a feeling of burning sensations which are related to esophageal refluxes and the peptic ulcer disease. And if you see a patient with pleuritic chest pain, it will be related to pneumonia and pleuritis. And according to this slide, if the patient feels musculoskeletal related disease, there will be a pain in the musculoskeletal system which can ranges from dull, achy to the sharp and intense pain that can worsen with certain movements.
So basically it's saying that if burning pain when you're having heartburns or stuff like that, that's the one that gets it a little bit confusing. But remember, sometimes burning pain can be cardiac pain, and that's what Dr. Maha is saying. So I think that's a good point. Okay, let's have a look at next.
So the most important risk factors are the diabetes, smoking, hyperlipidemia, high blood pressure, family history of the heart disease, age more than 40 years, cocaine users, and the sweating.
Okay, I think the top 4 are very, very important, and everyone sort of knows that. Controlling your sugars is very, very important. And I have a lot of times, yes, everyone knows smoking is not good, high blood pressure is not good, and we discussed a little bit of high blood pressure last time. But the ones that get missed out a lot of times that are very controllable and get sort of slowly creep in is your diabetes, And people get confused a lot of time. Why do I get sugar? Why did I get sugar? I don't eat a lot of sweets and stuff, but you can still get sugar. If I get up in the morning and I drink lots of orange juice, let's say I drink a big glass of orange juice, I'm taking sugar. That's sugar. Even if it's fresh orange, a lot of the fruits have sugar in it. Sugar is carbohydrates, and carbohydrates is what causes diabetes.
So the characteristics of the chest pain, whenever you see a patient feeling like squeezing, tightness, pressure, or burning sensation on the chest, or heartburn, or fullness in the chest, and the patient feels discomfort or severe pain. These are all the features of the characteristics of chest pain.
Very good. Okay. Next.
And the most important is the relevant past and the family history. If the
Okay.
patient have diabetes, smoking, hypertension, ischemic heart disease, and obesity, this means that your chances of developing the same condition may be higher than the normal. So now I'm going to tell you about how you will diagnose your chest pain or how your doctor will diagnose the chest pain. Actually, the chest pain doesn't always the sign of a heart attack, but that what your healthcare provider in the emergency room usually tests for the first because it's potentially the most immediate threat to your life. They also may check for the life-threatening lung conditions such as collapsed lung or a blood clot in the lung.
Mm-hmm.
So the most immediate tests including are the blood tests, your heart proteins can be checked, the CT scans. CT scan can be spot a blood clot in the lungs or find an aortic dissection. The most important is the ECG or EKG. ECG can show if the heart is beating too fast or too slow. It can also show if you have or having a heart attack. And chest X-ray is very important. It can reveal your lung problems such as pneumonia or collapsed lungs.
Very good.
Like all other tissues in the body, the heart muscle needs oxygen-rich blood to function. The coronary arteries, which are wrapped around the heart, fill that need. In some conditions, fat can build up along the walls of the coronary arteries, reducing the supply of oxygen to the heart muscle. This buildup is called atherosclerosis. The three major risk factors of atherosclerosis are high blood pressure, high cholesterol, and smoking. This plaque can tear, causing the body's emergency repair system to rally. Blood components called platelets stick to the fat that is now exposed by the tear, forming a clot. The clot can completely block the blood supply downstream to the heart. Within a few minutes, muscle cells in the heart begin to die. This is a heart attack. The heart keeps beating but starts to lose its normal rhythm. If a larger part of the heart is affected, it can stop beating entirely. This is called cardiac arrest. Despite common misconceptions, a guy grabbing his chest and falling to the ground is not the typical presentation of a heart attack. Some people do experience the classic Hollywood heart attack, but the truth is, the symptoms of a heart attack can be much more subtle. Many heart attacks begin with only mild discomfort in the chest that intensifies over time. Other symptoms include pain in one or both arms, the neck, or the abdomen. Shortness of breath may accompany the pain, along with unexplained sweating. Time is critical in treating a heart attack. The condition can be totally reversible if diagnosed and treated early. Irreversible damage begins within 30 minutes of blockage, and half of deaths occur in the first 4 hours after symptoms begin. Doctors can perform an angioplasty to reopen the artery. Please watch my next video to learn more about this procedure.
So that's really brilliant, and I think it actually goes to what Dr. Maha is going to tell us next. The blood that is going to your heart is critical. So if it gets blocked by the cholesterol, by the plaque, by whatever phenomena, it tightens. We got to open it. All right. So go on, Dr. Maha. Why don't we pick up a little bit, just briefly tell them about what are the tests and what we should do next.
Okay, the follow-up tests, they are very important. Like coronary catheterization if this test can help your provider to see blockage in the heart arteries, and the most important is the stress test. These tests often involve walking on a treadmill or riding a stationary bike while heart rhythm is watched. Exercise tests help show how the heart react to your exercise. If you can't exercise, you might be given a medicine that affect the heart like exercise does. So the next is echo. Echocardiogram may be done to get better picture of your heart, and the CT scan. It's the different type of scan that can be used to check the heart arteries for the blockage. So the most important is your lifestyle changes.
Oh, that's one of the most important slide you have. Walk us through this. What would you do? What's a healthy lifestyle? We get confused at times.
So it's helped to prevent some of the chest pain, like you should choose fruits and vegetables over unhealthy fatty foods. We should eat healthy foods, we should eat healthy diet, maintain healthy weight, regular exercise, manage your stress, avoid consuming foods that may lead to heartburn, such as spicy and fatty foods and acidic foods. Most important is that we should visit to a doctor on the regular basis for the health screening. Okay, now the medicine used to treat some of the most important causes of the chest pain include A3 relaxers. The nitroglycerin is usually taken as a tablet under the tongue, and the aspirin, clot busting drugs.
So aspirin is very important for those taking it. Artery relaxers are important when you're having a heart attack. Those are important. And sometimes you have to use the clot busters who to open up a vessel. And then I am sure there is the next one which has opening it. If it doesn't still open, then you have to go in with a catheter or balloon, open it, or try to do surgery. If it's not repairable, you have to do surgical procedures. So
Yes, then the procedure or the surgeries are very important. If a condition is severe, then percutaneous coronary intervention is helped to open arteries that have blocked or narrowed. Heart bypass surgery, and sometimes if your condition is related to pericarditis or pleurisy, then the doctors have to remove the accumulation of fluid. Then catheter assisted removal of a blood clot in the lungs. If the patient condition is related to gallstone, then we have to remove the gallbladder.
really brilliant, very good, excellent presentation. Thank you, Dr. Maha, and you've walked us through touching the important aspects of it, and I'm sure all of us in some way have benefited from your presentation. We appreciate that. I want to congratulate, Dr. Mehak Ali for her best response. Dr. Mehak, thank you very much. It was brilliant what you wrote, so well done. Well done. And then the question for next week is up, and it is: when faced with chest pain, how do you differentiate it from being cardiac versus not cardiac? And now that you know a little bit about it, what will you do next? Okay, so that's that. Next week is we have a very interesting talk. This is going to come from Dr. Robert Pearl, and he's going to talk about his book that is recently published. It's about ChatGPT. It's called How ChatGPT is going to change or is changing the healthcare system specifically. So he'll be here in the second part. And Jeremy is going to be taking up the first part of the presentation, and he's going to be talking about ChatGPT in general and what has been the impact of ChatGPT on it. So it's a very interesting topic, and I think you all gonna have benefit from it because it's unbelievable what's going on right now with ChatGPT. ChatGPT is everywhere. Not ChatGPT, just AI. I want to use the word. So, and you're gonna see even a bigger, broader impact on ChatGPT. So with that, I think we're going to conclude, but right at the end, I just want to thank my production team with this. Just want to let you know, there's a lot of people making effort behind the scenes for you guys to see this. And it may seem very easy to do, but it's really not. And they do a lot of research. So thank you for Rida, Zalika, Sabah. There's a lot of team members behind this that is working. And yeah, Maya is reminding me again, don't forget to like, don't forget to subscribe, because that matters a lot. And we invite you, have your friends and family come over and discuss. And if there's any questions, just bring that over bring them over as well, because that is sort of like we encourage them to come. And thank you very much, and hopefully we'll see you next week.